Second.
All right, so first agenda item, we have representatives from the Nova Scotia Health Authority here this afternoon. We have Brett McDougall, we have Angela MacArthur, and we have Glenn Bryan. So welcome to council. And I spoke with Brett. They have information they're going to provide for us, and then we're going to open it up to any questions, comments in regards to our sites in Victoria County. So I can turn it over. Welcome, folks, and we'll turn it over to your presentation. Please proceed.
Thank you, Ward. I just want to thank, turn this on, or?
If you press it and you get a green button, you're good to go.
If it's green, I'm good?
Yeah.
Okay. So thanks for the invite to come back to council. Appreciate the opportunity to come and have discussion around healthcare in your county. Again, Angela MacArthur sitting beside me, Glenn Brand, we have Lynn Gilbert, who's with us off to the side. So our goal here is just to share some information on the two facilities within the county, healthcare services here locally. And so we'll go over just a brief update on COVID, and then we'll get into some of the services within the Buchanan and Victoria County Memorial Hospitals. So again, I want to thank you for the time. Just something to touch on over this past year, and it speaks to the importance of partnerships and how we value our partnership with council and other stakeholders and communities. And I think we'll all remember the storm that we had to endure, particularly here in Victoria County, and the impact to Neils Harbor and the communities in that location. And just to highlight the importance and the strength and partnerships across the board. So, you know, the municipality, councillors, and the resources that you have at your fingertips, Nova Scotia Health, emergency services provincially, the local team at the hospital, and the community members locally in those communities that are served by Neils Harbor, collectively coming together, being very creative in how we were able to address challenges there, working with DNR and flying staff members and others back and forth. Just a tremendous show of what we can do together as partners. And just wanted to take this time and thank everyone here. It was, a tremendous challenge for the communities and for our teams there. And it was because of your support and us working together that we were able to improve the situation and work through that situation. Just in relation to COVID, and I know we spoke to it the last time we were here, but really you just wanted to give some quick stats because COVID hasn't gone away. Although in the communities, people are becoming a bit more, attuned to a decrease in public health measures. But it's real for us. It's real for your communities, and it's still a significant challenge. And that would be relevant by way of some of the service closures that we would be having right across the province and within Eastern Zone. Health, human resources were a challenge before the pandemic, and it's just been exacerbated by the current situation. So just as of today, and Lynn was kind enough to update my numbers, there's 101 staff off within the health services in Eastern Zone. Provincially, we had 170 positive tests, and 77 of those in Eastern Zone. And we still have 13 active care cases in the region. So in the Sydney site, we have 2 patients in ICU. We have 8 patients on the COVID unit. So those patients would be in because they have COVID and symptoms and management in relation to having a positive positive COVID activity in their person. And then we have a slew of other healthcare facilities right across Eastern Zone that have patients in for other healthcare reasons and have COVID. So as of this past couple of weeks, we were anywhere between, and this is provincially, 100 to 150 cases that are in with other symptoms but have COVID. We can fluctuate anywhere between 10 and 16 ICU cases. And again, these are provincial numbers. And in the acute care COVID units where people are symptomatic because of COVID, it can go between 30 and 40. So I just want to highlight that our teams are still challenged with COVID. It's very real. And we're working together with our teams locally in every facility and every service, trying to, work through these challenging situations. But it does cause some challenges for us. And that's not uncommon. It's right across the province. It's right across the country, the continent, and evident right across the world. So some of the impacts, we're still having impacts to surgery. So we're trying to get back up to our norm. It's very challenging when we have other patients occupying beds that were once used for surgery. We've continued to work on urgent and emergency services for surgery. So anything cancer related or emergency in nature, we've continued to provide that right through the pandemic. But trying to get some other specialty type cases done, like orthopedics and things that may have been delayed, we're still working on a daily basis, and we meet daily and through the weekends, trying to ensure that we're managing things just as situations either resolve and or come to light. So again, it speaks to the amount of work that's required to move through this challenging situation for the past couple of years. But we're focused on trying to increase access to care, and hopefully we're getting to a point where we're starting to see some services back to 100%, but there are still others that are impacted. So that's really, I just want people to have the context that we're still in it, and it's still quite challenging. I think you would have heard Action for Healthcare. So Tim Houston and the Conservative government just outlined a plan in relation to some of the key focus and priorities for the province, and then an outline of some of the broader points on some of the solutions about trying to create the province to be a magnet for healthcare providers. Trying to make sure that we, where appropriate, provide access closer to home in our communities, trying to cultivate excellence in the front lines, direct care providers, building accountability at every level, being responsive and resilient. And I think our healthcare team has just been that over the last 2.5 years. We've dealt with the pandemic extremely well, given the situations that we've been faced. And then the other thing is just addressing factors affecting health and well-being. So, we're trying to look at those upstream impacts, preventative care and health promotion going forward. So I think that's setting the stage for a promising future. And then there's some investments that we've been making. There's a lot of access or increased access by way of virtual care. There's a lot of specialty services, mental health in particular, wound care, virtual health. And then we have some traveling clinics as well that we're trying to get back up. And I was just, Dr. Wiggins was at the site here locally in Badek. She's a geriatric specialist who is helping to do some assessments here. So again, we're trying to get our teams back out where able, and trying to promote care as close to home as possible. So they're just some of the highlights. I'm going to ask Angela and Glenn to comment on sort of each situation in Victoria County Memorial and Buchanan Memorial around, physician recruitment, and then what's happening by way of services at the site. Just one other mention of note that we are looking at, in particular, Victoria County Memorial around the work that was done years ago with the master planning around space and facility development. So we started down that path. We have surveys, maybe 80% of the services where we've put out a survey to talk about, future requirements, potential future expansion. And once we get those surveys back, we'll compile that. We'll use the former plan that was done in 2013. And then we'll circle back as a site, including the physicians, and then we'll reach out to other stakeholders like the foundation and perhaps yourselves, just to give you an update on where we are. And we're hoping that that can help build a plan forward for that facility in particular. So I'll pause, and maybe we'll start with Victoria County, and maybe Glenn, if you want to touch on the physician recruitment aspect or where we are.
Sure. Yeah. Thank you. Just by ways of update, Bill O'Brien, a local recruiter for the Eastern Zone, just spent the weekend in Ottawa at a rural family medicine conference. So the no returns obviously this early, but the reports were positive on that. And certainly this jurisdiction was a big part of what he was representing while he was traveling. Currently at Victoria County, there's 4.5 physicians approved, which is it's a bit confusing, but Dr. Genge's panel size was so big that when we were planning around his eventual exit, he was weighted as to an equivalency of 1.5 physicians. So we've got that 0.5 lingering. There's 4 doctors right now, or 4 full-time equivalencies being occupied by 5 different physicians. So 2 are split in 1 role. I'm sure you're aware of that. And we've got a new physician coming in the summer of 2023, Dr. Bonner. And we've been assured that while we're recruiting for that 0.5 position, we will have the flexibility to add another 0.5. Hopefully, if we can get another full-time person that would be interested for that position. So recruitment is active for sure. As I'm sure you're aware, there's been a number of challenges with respect to emergency medicine here in the last few months. Workflow here and resources has been challenged due to some of the other closures in the Cape Breton municipality. We've worked very closely since I've joined the organization. I've worked very closely with Dr. Gill and his team here to try to support them as best we can through the challenging time, and working with Department of Health and Wellness to see if we can ensure, what I call a predictable and sustainable model of care in the emergency room. That could look different than it did historically, but again, we think that the model that we're aiming to achieve will be predictable and sustainable and will well serve the communities that it's currently serving. The good news is things are stabilizing in the Cape Breton Regional Municipality, and there's less folks seeking care in this jurisdiction. They're getting their care closer to home, and therefore registrations are declining here finally, because that's been a challenge for the teams here. So that's it for physician update.
Okay, and I can review the other staffing briefly. So I forget how we did this the last time, but I think we went through a few of the departments that there were some concerns. So for nursing, we still are challenged with recruitment and retention for sure. At Victoria County, we have 10.45. So we have like 10 full-time and a part-time position for RNs. And right now we do have 4 full-time and a 0.45 vacancy. And I think, just to add, certainly the vacancies, the temporary leave of absences continue to be our hardest to recruit to. The permanent one's not as difficult, although they're not easy, but certainly the leave of absence are the most difficult. And we see that right across, the zone and provincially. I think those temporary positions are hard to fill. And we are, we post all of our positions, especially in some of these rural sites that we see a lot of turnover. We do have incentives added to those. So there are $5,000 to $10,000 signing bonuses for a 2-year return of service, plus up to 5,000 relocation bonuses. We have been using travel nurses a bit in all of the rural sites, Victoria County included. We do have, we still are successful with entry-level nurses. We did hire a new hire back in the fall, and we do have another entry level starting in June, like a new graduate. There is a travel nurse coming. She should be here now any day, and she's here until June. I'm saying she, I think it's a she, until June. And from the LPN perspective, they are much more stable than the RN positions. We have hired and orientated 6 casual paramedics, ACPs, to help support the nursing staff at the site when we are challenged to fill all those RN vacancies or casual shifts, you know, especially those short-term sick calls and things like that. We can call in the ACPs if they're available, and that has been working well. That's something we just started back in the fall. We also have casual nurses from other sites that will come and help in the deck. So we still continue to be challenged with that turnover and, you know, continuously educating those RNs to have them with those ER competencies so that the ER is not closed because of nursing reasons. It is challenging because we have to have that RN that's ER responsible always. Even if we have an ACP, there needs to be an RN with those ER competencies with them. For rehab, all of the positions are filled at BCMH, and those positions are combinations of both hospital and outpatient OTs and PTs. DI, I think since we were here last, they've added an additional DI tech, so they have 2 DI techs there now. And the lab has a permanent lab tech as well as a casual technologists and assistants. You will, as I'm sure you see, that see some temporary ER closures continue. For the most part, they are physician related, but there has been some nursing related, again, back to the RN responsible, the ER competent nurse. And COVID has certainly had an impact on that. But because we have all across the zone had impacts with people off with COVID, short notice sick calls that are very difficult to replace. One thing I wanted to mention in Victoria, Brett referred to some of the virtual pieces, and just wanted to highlight the virtual mental health that we started across all of the rural sites. We started initially in the Cape Breton rural sites, and we have now expanded to the whole zone. So, typically when we had persons presenting in a mental health crisis needing those mental health team to assess them, we would have to send those patients to Sydney to be assessed. But in the last few months, we've started a virtual project where they actually see the team in Sydney virtually. They don't have to travel. And what we would find is those patients would have to travel to Sydney to be assessed, but weren't always admitted and were then, allowed to go back home. So it was a trip that maybe was unnecessary. So that's been working very well. All of the feedback to date has been positive on that. It doesn't mean that those patients never have to go to Sydney, but certainly a percentage of them will not have to go to Sydney to go on to see the psychiatrist. And that mental health team will assess them and, provide follow-up appointments and, maybe medication adjustments, whatever, but they don't have to go to Sydney for that. So again, that's been working well. And that's happening both in Victoria and Buchanan Memorial.
Like you want to touch on?
Sure. Yep, so
as well.
good segue there. So for Buchanan, with respect to physicians, there's 5 full-time equivalencies approved in that facility. Currently, we're functioning at 2.5 of these positions being filled. 1 physician's working part-time, so that's where the 0.5 comes from. One's recently returned, and thankfully another one is close to returning. We're working really hard to recruit here as well. It's a challenging geography without question. This group does a remarkable work in locums coming to the area, the culture of the facility and the connections that they've established through the years. They seem to have a wonderful working relationships with some of the folks that come for locums. So just this morning alone, that's processing paperwork for 2 locums that are coming. One later this month and one in September. So they always seem to piece it together nicely through locum work. And the same, we're always exploring alternative models of care when resources are scarce. So, we've talked about the virtual care partnership already, so I won't say too much about that. But in this particular facility, the virtual care project's allowing us to keep that facility open at night and offering care to the community for 24 hours. What's happening is, if anything significant is presenting to the ED, then the physician on call will present to the site. So they'll be able to come in and deal with those situations directly, as opposed to being there through the evening and into the night. We still are directing ambulances and all emergencies to go to this department. And so far, this model has proven to be quite beneficial. We haven't done a full analysis yet, but that analysis is underway, and we're hearing so far nothing but good things about that. And that model in particular is also supported by a nurse practitioner and also the advanced care paramedics.
And I can provide a bit for the nursing staffing and other staff. So for the nurses, we continue to have challenges there for recruitment and retention as well. There are 8.4 full-time RN total positions in Buchanan, and right now there is 3.1 vacant. Again, the temporary ones are difficult to fill, but there is permanent positions unfilled there as well, also with incentives on them. We continue to try to adjust schedules. Both the clinical lead and the facility manager there have been working shifts themselves, helping to cover the shifts to keep especially the ER open. The rehab there is a full-time OT that is filled, but that there is also a full-time physiotherapist position. And I think when we were here last, we talked about them retiring in the fall, and that position has not been filled yet. It's been difficult to fill. It is posted with incentives. They are providing support from Sydney for that position, but are continuing to try to recruit to that. Lab and DI both have their full FTE staffing there. There are also casual ACPs at the site that we've hired, and they have really helped support keep that emergency department open when we have nursing vacant shifts. They also have a travel nurse that's been there for a couple of months. And as Glenn mentioned, I'm not sure how familiar you folks are with the virtual program we started there as a pilot with EHS, but back in the fall, in discussions with the physicians, when we were, all of a sudden left with one part-time physician, semi-retired part-time physician, we really were in a quandary, wondering how we were going to be able to provide emergency care in that community. So it was really Dr. Murray, that was asking, how can we do things different? And is there something that could support me if I'm here alone? So EHS came to the table, and the EHS physician, and what we call the doc in the box, they are supporting Buchanan Memorial after hours at night, so that if Dr. Murray is there alone and on call, the nursing staff, once they triage those patients, if they're not, considered to be too sick, they can call the doc in the box and get virtual support from that physician, and they don't have to call Dr. Murray and get him in at night. So it's really been, just an innovative way to try to support him in the community. And at the same time, recognizing that sometimes we have to do things different in order to continue to make things work. So it means that he might get a little more sleep. If the patient needs to see a doctor in person, he will still come in. If there's an ambulance that needs to come to the hospital, they can still come. But if the person can be supported with that virtual doctor and the nurse, that's what they do to allow him to get a few more hours sleep. So it's been working well. The numbers are small through the night, especially in the winter. So we're just last week, we did that for the second week. So we did it a week in March, I think, and then a week last week in Buchanan. Again, those were weeks when Dr. Murray was there alone. And it's worked well, and it's just been another support for the community. And we've actually just tried it the week before in Canso as well, for the same reason, if it's a physician in the community by themselves for a longer term. Again, another way to support both the physician and the community.
So we'll pause there. I'm sure you have other questions that are related to healthcare for us, and
We do, and thank you very much for the information and presentation. I mean, and trust me, we understand and recognize the challenges that you're facing, particularly with COVID. I mean, issues in facing healthcare are tough enough, and then you throw COVID on top of it. So we absolutely understand that, particularly with the number of staff you have out and the kind of care that the responsibilities those folks have. So we absolutely get that, and we appreciate the update. I know there are questions from different counselors for different sites and different programs. So I'll start with Councillor McNeil and just a couple of quick comments for the District Health Authority.
Yeah, thank you, Warden, and thank you for the presentation and coming again. I'm just wondering, with COVID, like the government, this new government promised fixing healthcare, and everybody's heard it. Like now with COVID, is fixing healthcare in your guys' mind, bringing it back to levels prior to COVID? Or is it a concerted effort being made now to bring it to new levels beyond that? I don't know if you know what I'm asking, but.
it's a good question. I
Yeah.
think the answer is both.
Okay.
I'll use, we just implemented a new, it's called the PIC line team at Keeper Regional Hospital. So it's an investment of new providers to help with earlier access for an insertion of a catheter in your arm to get antibiotics so you can go home. So that's been an investment. If you look at the additional NP in Niels Harbor, help support primary care. We're looking at trying to do more surgical cases in some of our surgical sites. So sort of targeted effort on some of the longer wait lists, such as ophthalmology, cataract surgeries, endoscope, so gastroscope and endoscope procedures. Obviously, there's going to be focused on orthopedics. So there's some of the ones that we were getting close to some of the national benchmarks. We're months off. Certainly, COVID is sort of back on us quite a bit more. But the intention would be for us to get back to those levels and then get above that capacity so that we can start to catch up and then offer an even enhanced access to healthcare in some of these areas. So mental health, addictions and mental health has seen some investments. We've introduced the virtual care for access by way of rural communities. So we're really trying to see if we can leverage technology and where we have the ability to bring in additional human resources where possible, see if we can increase where we can. But certainly, the pandemic's still ongoing. I think it's exacerbated some of our HR issues, but I think, government is interested in exploring any and every opportunity to try and get healthcare providers to Nova Scotia. And we're working with them to explore any of the options. So we're hopeful, and we're going to try and make gains where we can and do extra and provide additional access where we can. But we'll have to, work through some of the other challenges where they present and continue to try and just make strides when they're available to us.
Councillor McLeod.
For presentation and the update, just you went fast about decision, the doctor's decision. So you say we have 4.5%, right? So with the new document somewhere, we will cover that 0.05?
No, there'll still be a vacant 0.05, but that'll depend on what Dr. Genge officially does. Like Dr. Genge is still practicing in his family practice, and I've just spoken with him just weeks ago. He's still very much enjoying that. So there's a kind of a bit of a balancing act between when Dr. Genge will officially retire or whether he'll continue to practice and the impact that'll have on the equivalency Yeah, but what we would see happening in all likelihood is when Dr. Bonner comes, Dr. Genge is likely gonna wind down and finally get his retirement that he's been looking so much forward to. And we'll be left with a vacant 0.5,
Oh,
which we'll continue to recruit for the whole time.
yeah, and just a last comment, this last you said is having a closing ER of it. And you asked the question about the physician more often than the nurses. So, good job, and I think with the opening the north side, it's going to a lot of questions about the hospital. And congratulations for that beautiful assessment. I think it's going to be a very good idea for that. And so always, the hospital is welcome. We can make more office space. So,
Any questions for Nova Scotia Health Authority? My apologies, I called you the District Health Authority earlier.
Hi, thanks for coming and thanks for your presentation. The last time you folks were here, so some the same and some different. There was, I believe that there was John Bryan who was recruiting, and I had asked him at that time about a specific case of a doctor that really wants to come here from Germany. And here was the College of Physicians and Surgeons that don't accept his education, and he's going to look into it. So I just wondered if anything else came back when you folks followed up and maybe get back.
Yep, well, Dr. Bryan's actively followed that, and ironically, just 2 weeks ago, the college has changed its restrictions such that there's potential for a pathway for this physician to make his way to the area. So, and that's just 2 weeks ago. So we've already reached to the physician, the recruiters are involved. And if there's an opportunity for us to take advantage of that pathway to get them here, then obviously that's what we'd want to do.
Well, that's excellent news.
Yeah, and Don, sorry, he wasn't here to share it himself, but one of the orthopedic surgeons is down with COVID, and another just had a emergency C-section. So he's actually in the OR today. That's the only reason why he isn't here. He's picking up some of the cases that need to be done in the OR.
Well, I'm really happy you followed up on it and that he actually got results. I mean, that's
Well,
going to be great.
Well, not results yet, but we've got a pathway. Yeah.
Yeah. So that's it for me. I'll leave the questions.
Thank
to the
you.
rest of the
Just one other comment there. You know, I know Dr. Don Bryan's working through the process there. Really, some of those challenges are working with their college there and trying to make sure that the physician who may be trying to move to Canada, that they're able to meet the education requirements that the college is willing to accept. So although we would love to take everybody in that gives us notice that they want to come here, some of it does rest with the college, but I think it's great that Don's followed up and some progress there. So just, we can be cautiously optimistic on that one.
Thank you, Counselor. Counselor Patterson.
Thank you, Warden. Welcome to Bedeck in Victoria County. It's good to see you again. It's good to get the update. I just want to tell a small personal story. There's a lot of good things going on in the health system. I had a minor surgical procedure a little over a month ago. My phone rang at 20 after 5 yesterday, Sunday. This is the doctor giving me the report. So, I mean, you know, there's things, I'm sure I'm not the only one that happens to, but the service and I guess the professionalism and the caring, I guess is the major word for them too, that these people put into their profession is really outstanding. So I think anytime the wait lists are long and there's not enough money and blah, 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 whatever, you can think of those things that take place every day with the staff and their patients. So, and you're partially responsible for that, I believe, too. So congratulations.
Appreciate sharing. Nice to hear the good news stories.
Deputy Warden Duffy.
Thanks very much, guys, for the presentation, and thanks very much for coming. I guess we keep hearing, got to think out of the box to try to get people to come. And the biggest thing in northern Cape Breton or in north of Smoky is still comes back to housing. We can have all the people apply that they want, and what the barrier that becomes is that they cannot find housing. Actually, on social media 2 or 3 weeks ago, we had the foundation looking to wonder if anybody had a car they could lend a doctor that was going to come in the area and stuff like that. Has there been anything positive coming out of maybe providing housing or looking at housing anywhere in the province, or is that still something that's not being looked at?
I don't know, it hasn't been looked at. I think, there's 44 facilities across the province, and I don't know if we fully explored the interest in getting in, being landlords of homes, but certainly I think there's partnerships out there by way of, with municipalities, with foundations where people we work together to provide some form of housing. It's not uncommon. We've run into it in several of the communities just here in Eastern Zone. There are some occasions when we try and support travel nursing, but again, it does come down to housing availability. But that's something we can take back.
Okay.
It's a concern raised. Again, I don't know if we have an easy solution to that one, but
Exactly. Well, I think it's critical. I know the municipality, we've provided 2 houses in the Neils Harbor area, and it's been very successful. Now, without them, we probably wouldn't have anyone down there. And it's the constant question all the time. And as we look for more homes and stuff in the area, we try to grab on anything we can. But I really feel the health authority has to take the lead on that and start looking at actual facilities. If they're building something new, put some apartments in it or whatever in order to attract these people. But yeah, if you could bring that back, I'd greatly appreciate it. The only other thing, I don't know how involved you are with EHS as far as the ambulance service. I don't think you are, but if you can bring that message back, something's got to be done. I mean, I know north of Smoky right now, I'm in the fire department down there. I've seen the ambulance sit there with nobody in it. I've seen a member of the staff sitting there waiting for an ambulance to come pick them up. A number of times, I know for a fact there's no ambulance even in the area. And I'm hearing nightmares every day about different things within Cape Breton of what's happening with ambulances. So if you could take that back, that the government's got to start looking at it. It's critical. There's going to be a major catastrophe one of these days, and we're not going to have an ambulance available. So if you could bring that back, I'd greatly appreciate it. But once again, thanks very much for coming. I do appreciate the time you put into it. Thank you.
Thank you. And I was just going to say thank you to, the many organizations in Neils Harbor, because we do have, although we need housing everywhere, Neils Harbor is one of the communities where I have responsibility that we have more than others. And because of the support of Parks Canada and the municipality and the foundation, we do have a couple of options. And as well, we have a couple of overnight rooms, or I think 3 in the hospital. So it makes a huge difference because we do take nurses and, lab techs from Sydney that maybe come just for the night. So those rooms are great for that. But then we've had physicians, locums, we've had lab techs use the apartment and the house. So it's a challenge in all of the communities. And the cost of it's not even always to find the housing, it's the cost of it when you do.
Morgan, any questions or comments, please?
Hi, thanks for coming today. Councillor Daphne touched on the housing, which is important. You said with the lab tech in Neils Harbor, is he there just temporarily? Or are you looking for somebody, or is he there permanently? The blood technician?
As far as I know, he's there permanently. He accepted that permanent full-time.
That's
There
good.
was incentives and he,
It's good to hear.
he came.
Yeah, I was hearing that it was just part-time sort of thing, so I'm glad.
No,
I'm
not
glad.
to my knowledge.
Good. That's all I have. Thanks.
McDonald.
Yes, thank you for coming today. Just to touch base back when you folks were here last regarding with EHS, had you sat down at the table with any representatives from EHS? Because a lot of concerns that I get from constituents in my area is that there's been instances where they've called for an ambulance to come to the emergency department. There's no ambulance to take them. And in turn, they've taken themselves to the regional center. So I heard you mention earlier about having like the doc in the box, which is a great incentive, and having the ACPs at Buchanan has been great as well. But to have all those initiatives in place, if there's no ground ambulance to take them to Cape Breton Regional, what are the next steps of the health authority to further that? I mean, you can have all the help within, but if you don't have a ground ambulance to go from Neils Harbor to Sydney.
We talk to EHS regularly. They're at many of the tables we're at. And certainly, we bring those concerns. I think they deal with many of the human resource issues as we do, especially with COVID. I think, not to speak for them, but and certainly, we see challenges off and on at any site as far as transport times and things. And, we have to manage that patient locally as long, until they come to pick up. I don't know, Brett, you're at more provincial tables than
Yeah,
me.
so we actually meet with them twice a week minimally for the last number of months prior, into the fall, with the intention of having discussions like you're suggesting. Certainly the challenge of, I think, human resources, again, prior to the pandemic and then exacerbated by the pandemic. They have equally the amount of staff out that we do. That was one of the concerns that they raised when we explored the virtual support. They said, if it's taking ACPs or any type of medics out of the area, then they didn't know if they would be able to support that just with the challenges that we're facing in many communities. So there's no easy solution there. I think it's just we continue to work with them. I'm sure government is focused on trying to increase where we can have additional paramedics come into the system. I think that's what's going to be required to. There is the opportunity if someone's critical that we could use Flight to get individuals out of Neils Harbor or any of our locations. We have that capability if they're critical, but sometimes you have those patients that they're maybe not so critical that they need lifeline, but they do need ground transport. And so one of the benefits of these partnerships with VHS is they're able to link in and partner with the local team and try and come up with how to manage the patient there until we can get the resources freed up. It doesn't come up with the solution of the immediate transport, but it speaks to some of the partnerships that we gain by having these tough discussions. So I'm hopeful again that we can recruit more people, and I know the government's looking at EHS and that as a provider and how to improve, but we're still going to be challenged with it.
Yeah, I guess my question there is would it come back to the health authority or does it come back to EHS if transport is not ensued from point A to B? Who's responsible?
Yeah, transport would be the responsibility of EHS.
Great, thank you.
Our
That's
responsibility would be to partner with them and try and manage the patient as best we could until that option's available. To move
Great.
the patient.
thank you.
Thank you, Counselor. And we're just going to wrap up here shortly. And I'm just checking to see, and I asked Leanne if we had any virtual questions, but we good? So I just have a comment. I mean, seriously, I look, the information you gave us today is excellent, but I've always had this issue. The community doesn't know this information. You're using council for, and I'll be frank with you, council is the best outlet for information that we're receiving from the district health authority. We've invested municipal money in both sites, both Victoria County Memorial and Buchanan Memorial. And this is the type of information, in my opinion, that has to get back to the communities. And I know we've had COVID. We've asked you repeatedly to either have virtual or in-person town hall sessions, and I can go down just a number of the things that you mentioned today. In mental health services, I know that's an issue in this community. I know it's an issue in Victoria County. We've asked that there be a presentation done here. It's supposed to be done in February. We haven't heard anything back. The recruitment issue, when you explain the issue here today, we get it, but unfortunately, a lot of other people, in particular, people that are in the community that are on recruitment committees need to know this type of information. That's not our job. I mean, we can be a conduit to you. The master plan for the Videc Hospital in 2013, it's been up there for 8 years now, 9 years. Where is it? Is there a role for the community? Are you involved in the community with that? So those are the types of things that I think just need to improve. And I know you've had your issues. I know it's been a hard time. I absolutely understand it, but somehow I think the road could be a little easier if there was much better communications within the communities. And we're talking maybe a meeting north and a meeting south with the public that you can host. And I'm not trying to be cruel, but it's the reality. You've got lots of great news, but nobody's hearing it. And if you don't get the good news, what do you hear? Criticism. And I had 2 or 3 things that I thought, well, I'm going to ask today, but you answered it. And now I understand it and I get it and you're addressing it. But there's just no way of knowing that. So I guess those are my comments. I hope it leaves a little bit of what I'm looking for as a counselor for this district, for sure. Not sure of any of the others, but I mean, we hold our healthcare facilities north and south to the highest regards. We're very protective. We're very committed to them. You didn't have to ask us twice to invest in them. We want them. We need them. We want to keep them. We don't want to lose anything. But we just need to improve the relationship, I think.
So thank you, Warden. I think we can certainly look at virtual options. I think at this point in time in the pandemic, we're still a little bit hesitant to be out in large crowds, even though I know
Yep.
That's what's been okay by community standpoint. But if we go and knock half of our team out, we don't want that as well. But certainly the virtual option is something that we could consider. If we could partner by way of that, I think that could line up. And or maybe smaller groups of consultation with community members. That could be something that we could consider as well.
Yeah, no, I would.
I'm opening up to what your thoughts are, best approach from your perspective.
I know it's for me, and Bedeck is mine. I hear it in this community, and I don't know if any of the other councillors want to weigh in on the communication part of it, but is there anybody that wants to add further to that?
It will be great if you have that community engagement. Maybe not just all these virtual, just maybe pass it on to us, and we can just discuss because it's very interesting and it's great for. I don't have Instagram so it's all about as the word say, the doctors how it works. Why do we have this close? But at least they know that you are taking care of that, and it's not just forget. So it's just that kind of information, just I don't know it's lost or really processed. But people need to know that because the hospital they don't understand it. So it will be for everybody. And then just one more thing, just practically we can set punishment the lines. Then we can pay for.
I noticed that today too, when I parked there.
So people reach out. Let's do the music.
Yeah.
But yeah, education will be great. That way people feel that
Anybody else?
Down north, same thing with communication and stuff. A lot of people don't know the answers. And, I guess I get concerned when I hear someone tell me they didn't call the doctor because they figured there's no doctor down there. And you actually hear that. And the information you gave today was perfect. And I think if we get that information out to the residents, it would be very helpful for everybody. So I definitely agree with the warden on that one. Thank you.
Yeah, I think it's just a reassurance of all the good stuff that's going on, and we want to help you promote that message as well, and I think there's just, as we've discussed, I think there's other avenues and other ways to do it. And again, I know you guys are putting out fires every 10 minutes, and I absolutely understand that. But if you could just take a few minutes and meet with some of the residents or give them the opportunity to have their issues, questions, concerns addressed directly with you folks, I think that would help a lot along the way. So I think it would ease a little bit of angst that's out there. So with that, I want to thank you very much for your time today. We appreciate it. And we very much would like to have you come back again. And again, if you wish, we will, in advance of coming in again, we'll send you our concerns and then you can address them in advance. We'd be more than happy to do that. But it is a priority for us to work with Nova Scotia Health Authority to make sure that our sites are maintained the way that you want them to be maintained and the way that we would like to see them maintained as well. Thank you very much.
Mr. Warden, if you indulge me just for a second,
Sure.
I just wanted to, for the record, recognize Angela and her great work. She's got a retirement pending. It may be the last time you see her in this capacity. Hopefully you'll see her on the beach or in the grocery store, but she's been responsible largely for the rural sites in the latter part of her career, and I think she's done a tremendous job. She'll leave a lasting legacy, and she's leaving very big shoes to fill. So I wanted to recognize that.
hoping we can do some community consultation before I retire.
Okay,
We
good.
don't want to let her off the hook.
No.
I
No,
asked
we-
her how long and she wrote 1989. She doesn't want to say the years out loud, I don't think, so.
Well, on behalf of council, on behalf of council, Angel, we certainly wish you the best when you do retire, and we know that you've been the rural face of for the sites here. We know that I know personally that we can reach out and talk to you directly, and been very good to get back to us and address the issues that we brought forward to you. Good luck with that.
Thank you.
Okay, thank you very much.
Thank you.
So we take the opportunity, since the Associate Deputy Minister of Municipal Affairs has made a surprise visit with us today. We'd like to ask him to come forward and give us an update with the department and answer any and all questions that councillors may have in regards to municipal affairs. Welcome, Mark Peck, please.
Hello.
Good afternoon. You're good. As long as your green light's on, you're good to go. You won't hear it necessarily in the room, but everybody else will hear you.
Green light's on. There we are.
You're good to go.
Thank you, Warden, and thanks everyone for the a bit of an impromptu situation I find myself in, but that's okay. I have an update. I was madly taking notes while colleagues from the health were here. So what I'll do is I'll provide you with a brief update in terms of some of the initiatives that we're undertaking with the Department of Municipal Affairs and Housing. And then I'll open it up for questions. First and foremost, it's no surprise why I'm here this afternoon. I'm here this afternoon to attend the Village of Bedeck meeting at 6:30 and thought, you're meeting at 2 o'clock? It's a while since I've been here. Why wouldn't I stop in? So, and it's always a it's always a privilege to come to this council for sure. I think it's a 17-year history in terms of working with municipal affairs, and prior to that, a 17-year history with assessment services. So I'm kind of no stranger to this council. And I will share, the warden will be interested to note this. We'll see how my attitude remains with the County of Victoria after the last weekend in May, where I'll be doing the Cabot Trail Relay. And I'm on a 17-kilometer route. I have absolutely no idea what it's like. But anyway, I'm all ready and set to go. So let me see, where do I start? Let's start with the minister's mandate. So I'll break the minister's mandate letter into two components, the municipal side and the housing side, because Minister Loers and our team is responsible for those two components, housing and the municipal affairs side. So on terms of the municipal affairs side, the minister's mandate was to review what's commonly referred to as equalization, which is the municipal financial capacity grant. And that's enshrined in legislation. It's been frozen for the last number of years, subject to a review, and now it's within our minister's mandate letter to review that formula. And that will form part and parcel of the memorandum of understanding, which is the second part of our minister's mandate letter. I'll get into service exchange after I give you the brief in terms of the minister's mandate letter, because service exchange dates back to 1995. And there's probably a few of you around the table that may not be familiar with service exchange. So I'll give you the broad strokes in terms of what service exchange was about and how it impacts municipal government today. One of the other components associated with the minister's mandate letter are roads, to take a review of the roads and the responsibilities between the province and municipal government, and to review the charter, the Halifax Regional Municipality Charter, and the Municipal Government Act, which is, as you know, your legislative framework. And the last part, it was to double equalization, which we did in the last fiscal year. On a housing piece, I know, I was I was kind of waiting for that. Just in case nobody got that dig, there's 49 municipalities, 9 of which do not get the municipal financial capacity grant, of which Victoria County is one. On the housing side, implement the housing. So government took on the responsibility of having the Nova Scotia Affordable Housing Task Commission commissioned a report, set forth a number of recommendations, and part of our minister's mandate letter is to implement those recommendations. And if you're keenly interested, you can go in and see the report. There's a report card that's available online, which will give you, it's an interim report card, which will give you an update in terms of where we are with each of those recommendations. An inventory of lands and identify parcels that are available and suitable for affordable housing and development, housing development. So those are part and parcel of the minister's mandate letter for municipal affairs and housing. So the piece that's of interest to all municipalities is the MOU, or the Memorandum of Understanding, which is in the minister's mandate letter, which is to replace Service Exchange. So Service Exchange is a document that dates back to 1995. Even prior, so I'm going to date myself. Even prior to that, there was a commission on roles and responsibilities dating back to 1991. And believe it or not, there was always this foundational document. Councillor Patterson may have helped with this, I don't know, dating back to 1974, which was the Graham Commission. And this Graham Commission, which was that was written in 1974, always comes back to municipal government in terms of some of the recommendations that Mr. Graham had recommended. Interestingly enough, back in 1974, the Service of Assessment, which is now PVSC, was a municipal responsibility. And one of the recommendations was to make it a provincial responsibility, which we did. It's one of the first things that they'd recommended. And interesting enough, here we are now, and we've almost come full circle where we have an independent organization, a not-for-profit organization. I think it's a not-for-profit, which is the Property Valuation Services Corporation, which is responsible for providing municipal government with the assessment role. So we kind of came full circle on that. And just by way of background, on the assessment side, I have a bit of knowledge with that because I'm a former director with Assessment Services, as Fraser would know, and maybe a few others. So we're tasked with updating or creating a new MOU, which will really form the ongoing foundation for the relationship between municipal government and the provincial government moving forward. This is really the path forward. It's going to be the future relationship, the future narrative between provincial government and municipal government. And some of the things that we'll be looking at within that document are the municipal financial capacity grant. What does that fiscal framework look like in terms of moving forward? What that looks like, it would be very predictive. I'd need the crystal ball right now, but we are working on it. And we have a team that's assigned within municipal affairs, and we have a couple of staff within the Department of Finance that are working on that. One of the things that we've committed to doing, which is a little different than where we were a number of years ago. Some of you may recall there were two initiatives underway. One was Towns Task Force, and the second was Fiscal Review. And there were some things from Fiscal Review that I want to say remain incomplete. I think there were 42 recommendations, and I think there's 34 or 35 of them which have been completed. There's a number of them that were set aside in the parking lot, so to speak. So Fiscal Review was a document moving forward. Towns Task Force was a document moving forward. And we have the work to, as I said, change that narrative. And what does this future document look like? We've started the work. We've committed to doing the work. Unlike Fiscal Review and Towns Task Force, which was a joint initiative between the province and NSFM, Nova Scotia Federation of Municipalities, and the Association of Municipal Administrators. We've decided that we'll do the work, and then what we'll do is we'll share our work with the joint committee that's been formed between the Association of Municipal Administrators and the Nova Scotia Federation of Municipalities. That joint working group has been formed. We've met with them twice to date. And I'm using that term, I'm using the term a litmus committee in terms of where will we be in terms of, or where are we headed? You go, what do you think? There'll be the litmus test, and then we'll vote for consultation with municipalities. But we've decided we take on the work ourselves because, and I'll be quite frank and honest, oftentimes the joint committee stuff can be a tough slug at times. And we have to move, we want to move quickly on this work. But at the same time, we want to be, we want to be evidence-based. We want to be thoughtful in our analysis, and we want feedback as well. So that's where we are in terms of the MOU. I don't think there's anything else that I'm missing. We had to present to Treasury Board to get approval to do this. We presented the documentation and we did get approval to move forward on it. The second big initiative that we're underway with is the Municipal Government Act and Charter Review. And we've asked government for permission to commence with that work, of which we have permission to proceed. We're looking at it in various segments. So we don't want to do all the work for the changes and then present it all at once, because as you folks will know, the Municipal Government Act is it's a voluminous document that has in excess of 24, 25 parts, in excess of 500 sections, and it's broken into various components. So we are reviewing those. We're looking at it in 5 categories: governance, fiscal, planning, services, and I forget the 5th. But those are the components that we'll be doing, and we'll be bringing components of that before government in each sitting. Now, at the end of the day, what goes forward, that's government's decision in terms of what the legislative mandate of the day's government looks like. But our intent is to bring those changes forward as we proceed with those recommendations. Back to fiscal review for a moment, and back to a former MGA working group that was formed, I want to say 2012. I could be wrong on that, where we did a substantial amount of work to a legislative framework. And there were a host of recommendations that still remained outstanding, one of which was fire services, and one of which that we're taking a look at now in terms of the legislative framework around housing and what's permissible for municipalities when it comes to housing and affordable housing. So that's the first start, and then the second part to that will be working with this committee in terms of the legislative changes that are required and feedback from municipal government as we move forward. Many of you will know the changes to the Municipal Government Act is ongoing. I don't know that we've actually been through a sitting since I've been with municipal affairs and housing where there hasn't been some form of change to either the charter or the Municipal Government Act in either a spring sitting or a fall sitting. So it's a huge piece of work to undertake. So that in essence is a bit of so there's the minister's mandate piece. It's a bit on the MOU. It's a bit on the municipal government charter update. A couple of the other pieces of work that we're working on with respect to municipal government is code of conduct. So you folks may be aware that we're working on a provincial code of conduct with a working group from NSFM and the Association of Municipal Administrators, AMA. It's chaired by Mayor Pam Mood. And I'm not on that working group, but I know that the recommendations will be going out for consultation likely in the summer. And so the legislative ability to create a code of conduct has been passed, but it's pursuant to regulation. And the regulation will be what is the framework of the code of conduct. And that's what's coming forward. So the legislation is permissive. It's already there. Now we're working on the regulation, what the regulatory framework will look like. I do know that the committee met, they're meeting every 2 weeks. And I do know that they met with Associate Deputy Minister Leslie McFarland from Manitoba, whose code of conduct has been touted as being kind of leading edge in Canada throughout. So, and I know that Leslie presented to this working group. The other piece that we're working on is the Elections Review Committee. So we did an election in 2020, as you folks would all know. And subsequent to that election, we always do an election review. We form a committee and we look at what some of the legislative requirements are to the Municipal Elections Act. So that work will be underway. And the other part that I'll draw your attention to, but I think you folks would be aware of it, is the requirement for a comprehensive municipal planning strategy, which I think Victoria County is one of 10 that are required to do that. I think it was a 3-year request of government. I know that Minister Porter was there at the time that it was brought forward, and that time I think is getting close. And I think it's the Eastern District Planning Commission that's doing the work for you folks on that. Yeah. We closed the call for the ICIP funding. That's the last tranche of that program, water and sewer related. I got the eye, so I know that there's an application in, so that's good. Housing. So that's the municipal, that's a very high level update in terms of the municipal piece. Housing, what are we doing? So I know that Councillor Daphne asked the question pointedly, what are you doing for doctor recruitment? I don't have the answer to that today. But I do know that there is lots happening. So if you go back to the minister's mandate letter on housing in terms of the implementation of the recommendations, I want to say there was 19 of those recommendations. I just forget how many there were, but work's underway. You'll note there is, it seems as though there's announcements weekly on housing in terms of programs and initiative. I know that Minister Lohr has taken his commitment on affordable housing and housing very seriously, as is this government. And we're working hard in terms of that initiative. Now, there's some things that I'll share with you that we've already done that may be of interest, maybe not. I'm guessing the first one will be of interest, and that's on public housing. So Nova Scotia province is one of the biggest landlords in Nova Scotia. We have approximately, and this is just ballpark, 11,500 public housing units. I know I don't know the exact number of public housing units that are in Victoria County, but I know in the Cape Breton Housing Authority, there's in excess of 3,000 units. So the Cape Breton Housing Authority is probably the second largest region, and there's 5 regions. There's the Cape Breton, there's the Eastern, there's the Cobequid, there's the Western region, and then there's the Metropolitan region. And the Metropolitan region have about 3,800 units. So one of the things that we've done in terms of change to the public housing is we've appointed a new CEO, Steve McIsaac. Steve McIsaac is the former CEO of Nova Scotia Lands. And he's working with his team and the team within Municipal Affairs and Housing in terms of looking what would be the future structure for public housing in Nova Scotia in terms of governance. That's the one piece. The other piece is that we've just hired Vicky Elliott Lopez. I shouldn't say just. Months back, we hired Vicky Elliott Lopez, who came from seniors and long-term care to be the Senior Executive Director in charge of housing. So if you were to delineate between the two, you have public housing and then a focus on supply. And that supply would be under Vicky, that and a host of other things. So the national housing strategy would fall under Vicky. All the housing programs would fall under Vicky. And then you have, and then the municipal affairs side. So that's a bit of a breakdown of how municipal affairs and housing structured. That's a bit on the housing piece. Again, this is somewhat unscripted, so bear with me. As I mentioned, no surprise why I'm here. I'm here to attend the session this evening's session with the Village of Bedeque. My goal is to take back the information that I hear this evening to the minister. The village has until May 1st to respond to the order. The order has 9 components associated with it. And I know we'll be anxious to see what the village position is in terms of moving forward. And I understand that you folks as well may or may not have a position. But what a lot of people that I'm surprised at fail, it always surprises me, is that I've heard it that the village of Bedeque doesn't belong in Victoria County geographically. And I'm always amazed to say, yes, it does. It's in Victoria County. It's not a freestanding municipal unit. It's a village. There's approximately 20 villages. Some will say there's 21. I will say there's 20 because there's one that's been inactive for a number of years. The most recent village to dissolve would have been the village of Harbour-Boucher, that a lot of people didn't realize was a village. And that was the most recent village. My background on structural change in municipal government has been, I want to say, extensive, dating back to Canso and Bridgetown, Hansport, Pugwash, Spring Hill. And if you want to go even long before I was even born, a lot of people will fail to remember that Port Hood was once a town. Wedgeport was once a town. Inverness was once a town and haven't been since the 40s and 60s. So we'll see what comes out of the village meeting this evening. And then Minister Laura will, pursuant to the order, the village have until May 1st to respond. So that's a very high level update, a little bit at the improv. So I apologize for that, but I want to thank the warden for the opportunity to speak. And certainly I welcome any questions you may have. If I can't answer it, I'll tell you I can't answer it, but I'll get back to you with a response.
Thank you. Thank you for the update, and you did very well unscripted, I must say.
Thanks.
I think we will open it. I know that we're not going to take too long. I know that it was not, you weren't scheduled to be on, so we're not, we'll keep our comments or questions very general. So perhaps Councillor Patterson, any quick questions or comments for?
Yeah, thank you, Warden. Welcome, Mark. Good to see you again. Haven't seen you in a while. Not a question really, but with all the things you've got on the plate there, it'd be interesting to see the results and the consultations that are coming out in the future, because you know, as you mentioned, they impact us probably very directly, and of course, if they impact us, they impact the residents. So, anyway, again, thanks for dropping in. Even though we were your second choice, that's all right. Thanks, Mark.
Thanks. Point taken.
Thanks, Mark. Always a pleasure having you in council. Geez, I got 5 or 6 questions, but I'll try to keep them short. One of the things you mentioned was PVSC. I was always under the impression that municipal units paid for all of PVSC.
That's correct.
Okay, I thought you had said it was a provincial responsibility, so I was
It
kind of
was
hoping.
provincial.
Okay,
Yeah, prior to PVSC, which was 2000, prior to 2007, it was provincial responsibility.
okay. So where they're going to be using PVSC for this new non-residence tax, what portion will the province be paying for the operation of PDC? Good
That
question.
I have absolutely zero knowledge.
Okay, okay, no, that's fine. And if you could bring it back, that's sure. A lot of people are not impressed with the new tax on non-residents. I think it's very unfair and it's going to be very detrimental to the investments that are going on, especially in the rural areas, but in particular in Victoria County. But if you take that back, I'd appreciate it. Oh, good speech, yeah. The big thing, what bill is it that will we pay if you close your business for 6 months, you get the rebate? Seasonal adjustment. Not that we've ever brought it up before, but I'm just wondering if we did mention to Minister Lower about that and he was going to look into it, but we've never heard anything back. Any update on that? Has it been looked at or?
So what I will say, it's certainly on the agenda for the Municipal Government Act review.
Okay.
It's on there. And as you know, there's I'll call it the sister department of, which is now Community, Culture, Tourism and Heritage that we would have to consult with.
Yeah.
But certainly it's always been on our agenda, more so now,
Okay.
where we're doing that comprehensive review.
Perfect.
Yeah.
No, anything on
Great
that would be
question.
great, greatly appreciated. You did mention housing was a big question I had was, and I think you may have answered it maybe on the site, but in that housing, you did mention that they were going to identify provincial lands available for housing.
Yeah.
We've never seen anything on it. Is that online right now, I wonder, for
It's
Victoria?
not.
Okay,
No, it's underway.
it's underway? Okay, okay, it'd be great to see that. But no, once again, thanks for coming and it's always a pleasure having you here.
Thanks.
Thanks.
Councillor Org.
Hello, being the newbie, I'm sitting back, taking all this in. It's kind of overwhelming. So I have no questions right now. I'm just going to sit back and listen.
Okay, thank you.
Councillor McDonald, you've met.
Yes, thank you,
Mr.
Warden.
before.
Thank you, Mark, for coming today. It's nice to see you as always.
Thanks.
Just when you mentioned about the 9 municipalities that weren't included, could you just give it just a quick explanation as to why they aren't?
Yeah,
Just for my
yeah, I
education,
can.
please.
Yep. I'll try to be as crisp as I can. So the Municipal Financial Capacity Grant, AKA also known as equalization, is based on the formula that's prescribed within the Municipal Grants Act. So Councillor Organ there's a test after this, so we'll see how you do. So within that legislative framework, that formula is set based on, 4 components. Uniform assessment. I'm not doing a very good job of this. There's 4 components. And based on those 4 components, it assesses ability to pay. And when you do the formula, there are 9 municipalities that are identified within the formula that do not require funding, of which Victoria County is one. So interestingly enough, our neighbors to the east, Cape Breton Regional Municipality, when you do the formula, so the formula is approximately $30 million. That's the current formula. And then there's a town's foundation grant on top of that, which is $1.5 million. So I'll cover off the town's foundation grant first. Town foundation grant dates back to service exchange, where towns were compensated $50,000 each for roads. That's the whole background on that. Equalization, there's a formula. 2/3 of the funding comes from Nova Scotia Power. 1/3 of the funding comes from the province. So you take that pot of money and then based on the components just prescribed within the Municipal Grants Act, it's mathematical, it then determines who gets what. Cape Breton Regional Municipality get approximately 50% of this formula. That's just as an example. And Victoria County is one that doesn't get it. Kings doesn't get it. Guysborough doesn't get it. I don't believe East Hants gets it. Yeah, I don't have the numbers here. So that it's an equalization formula, municipal financial capacity formula that's prescribed within the Municipal Grants Act. And it's math is what it is.
Is that something that could be brought up under the review as well?
Oh, so that's part of the minister's mandate letter. That is the essence of the MOU. It's one component of the MOU that we've been tasked to do. I'll share this with council. I'm absolutely ecstatic with the minister's mandate in terms of how it's structured. Because this is something that's been on our radar for, well, it's been frozen. I'll look to Leanne. It's been frozen for at least the last 6 years. So now it's enshrined in the minister's mandate letter that we have to rectify the situation. So, and again, Councilor McDonald, as to what it will look like, what the end result will be, honestly, I have no idea at this point.
Thank you, sir.
Welcome.
Councilor McNeil, any questions for Mark?
Thank you, Mr. Peck, for coming here today. It was mentioned last presentation too, and I mentioned it in a number of presentations here. Communications between the provincial government and municipal government. I can give an example with the non-resident property tax. Like we didn't know anything about it probably until the week. Oh, here, no, it's okay. Until the week prior to it being announced. And it seems to, I know it doesn't affect directly affect municipalities, but residents believe that when they see a property tax, it's a municipal property tax. And we're getting a number of phone calls. And the communication was nil between the province and municipality. I wonder if you could bring that back, and especially with the figure that they came up with too, like that $2 figure per 100 for a rural community, and they have a lot of non-residents outside the province. That's going to hurt a lot of rural communities. Even if that number was half or like a quarter of what it is, people would accept it much more than what it is. So I just wanted to say that.
Yeah, so I'll take that back for you.
Yeah, thanks.
Councilor McLeod.
Thank you for all the updates. It's a lot to take in. The councilors, I just asked the questions I have a doubt, and good luck in the cabinet.
Thank you.
Councilor Longa, any questions, comments?
Which leg are you running?
I don't know. All I know, it's 17K and it's probably
Okay.
hilly, so I'm okay.
Oh, okay, because I'd be out cheering you if you're running by Wreck Cove. But you get to do Smoky Mountain then.
Bring it on.
But yeah, as far as what you've told us today, the MOU relationship between the province and the municipalities, I'm glad to hear they're going to be discussing that for several reasons. Well, the equalization thing that you just said we don't get and other people do. So that's a good thing you're going to review, but also that non-residence tax, I'd say ditto to what Larry and Paul both said. It's like really going to hurt Victoria County in a big way. And I think that it's so important that the clauses get put in that if it goes through. So it doesn't affect a lot of the people that are non-residents that have been coming here, some for like 20, 30 years and contribute hugely to the economy in Victoria County. And thank you for coming. And
Thank you.
will you be at the conference in Liverpool as well?
I will be, yeah. Minister Lohr is attending the session Wednesday evening, and then he speaks Thursday morning. He's giving opening remarks. So I'll be there, and Deputy LaFleche will be there with Minister Lohr. Yeah.
We'll see you there.
Sounds good.
Yeah. Go ahead and I'll wrap up.
Also, a couple of things that are coming out. There seems to be more allowing to spend, which sort of rural lands down to municipalities. So that's that. And then last point. I believe that there possibly is a municipal collaboration on.
You're close. Yep.
So, we have to take some steps in the near future, hopefully.
Yep.
Whatever it's called.
Yep. No, that's great. The one piece I'll just follow up on is the former gas tax program. I forget what is, they changed the name of the gas tax, but I'm still saying equalization. So, federal program, I believe there was a letter that had come out from either Minister Lower or Hardy Stuckless and identifying that that program has changed and it's the ability, it's a federal program, it's not a provincial program, as you folks know. And there is a change in that program to allow expenditures for fire departments, and I think a letter did go out to municipalities. I'm quite certain it did. Yeah. Thanks.
Just a quick comment, just in regards to housing, and Deputy Warden and I had sat in on a couple of virtual meetings when they were coming out with the affordable housing report, and we brought up in particular the issues that we're facing, particularly in whether it's North or South Victoria, doesn't matter, but the impact that short-term rentals have on our rental stock. And it's just difficult whether families are trying to find a home, whether it's employees, people moving into communities trying to start employment, they can't find a place to live. You know, it just ripples out, and that wasn't referenced in any great detail in that report. So just a suggestion, maybe if you kind of bring that back and see if it could be brought out a little bit more strongly. And we were disappointed that that wasn't addressed in more detail in that particular report.
Okay.
So, and we're still facing that, and we're seeing a good opportunity for a lot of development in Ganesh in particular. And if you don't provide basic infrastructure, i.e. housing, it's a big struggle. So, and we're seeing it now for any of the employers here, whether they're permanent or part-time, just finding a place to live, to work in these communities is the number one probably issue facing those folks when they come in. So, other than that, the code of conduct, I'd be interested in that. It'll be interesting. Is there going to be something coming out on that? Not that we need it. In fact, we're a pretty good example.
Yeah, I think they're looking at finalizing the recommendations in May and then going up for consultation thereafter.
And that is going to be legislated and regulated.
So it's
by
the code of
province?
conduct is already legislated.
Yes.
So this would be the regulatory framework, which in essence will be, for lack of a better description, here's what has to be included in your code of conduct.
Okay, so I guess my question, I think you kind of answered, is like we as municipal government would be able to discipline our municipal representatives as opposed to the province disciplining if it was required. You know what I'm saying? If it was required,
do.
like we should be able to kind of deal with our own at our level as opposed to having the province try to.
Yeah, I know that, look, I'm not part of the committee. I get feedback from the members that are within my staff that are there. Disciplinary is an interesting topic.
Yes.
It's a very sensitive topic. Some councils deal with it differently. Some councilors deal directly with it. But what we're looking at, I say we, the committee is looking at is a provincial wide standard throughout. So it'll be interesting to see where they land. Yeah.
No, it will. All right. Well, listen, thank you very much for the overview today. And thank you very much for visiting Victoria County and Baddeck today. And we look forward to seeing you at the end of the month in May when you're blazing through the highlands. And whichever leg it is, 17 kilometers. I got good news or bad news for you on that one, just from experience. So
bring it on. I'm all right. Thanks for the invite.
Thank you.
Thanks,
We're going to take a 10-minute break. It is 24. Thank you. So we're going to reconvene council. Next item on the agenda is taxation update, and that's going to be provided by the CAO.
Go way back up.
My apologies, I read my agenda wrong. We're going to look at the minutes of April 11th, 2022. Those minutes have been circulated to you. Are there any errors or omissions in those minutes? Hearing none, we have a motion to approve the minutes of council meeting April 11th, 2022. Moved by Councillor McLeod, seconded by Councillor Morgan. All in favor?
Aye.
Contrary minded, the motion is carried. Any old business? We'll turn over to CAO and then questions from council, please.
Yeah, I just have a couple of things from old business to bring up. We have scheduled a meeting with Department of Public Works. It's scheduled for May. We have also received a list of the J-class roads that everyone has asked for, and we'll forward that along. Just to let everyone know that heavy garbage, which is really exciting, this is what we get the most questions on online right now. Heavy garbage is happening in all areas of the county May 9th, starting May 9th, should go for a couple of weeks at least. We only go around once to all locations, so please have your items out no earlier than 2 days before that. And if you don't have it out by May 9th, you may have missed it. We are also scheduling a meeting in May to discuss a couple of bylaws and have our admin update. I have not received anything back from questioning the village related to the playground group. It's been referred, but have not heard any updates on that. Fraser had a question on the road name sign. The sign has now been ordered through the Department of Public Works, and both Public Works and EDPC have both approved that. Paul, related to your question to meet with CBRM, I was speaking with them. They say Sidport still has plans for the railway, and at this time they are not interested in discussing. And thanks to Barb for her work on the Ukraine survey that is now available on our website.
Questions or comments for the CAO in regards to old business? Okay, moving on. I just had an item.
Leanne, I take it we went with contractor north, did we?
Yes. I'll let you know. Yeah, there was only one contractor that put a name in, put a bid in.
Councillor McNeil. Any other questions or comments? Anything else?
So yes, I did have a call with Nick Charlton related to the courthouse assessment and next steps. And I will be bringing some information forward. I'll be gathering his information that I have coming forward.
Thank you very much. That is it for old business and business arising. So the CAO's report and a new business, please.
Yeah, so just want to let you know some things that are going on in a few different departments around the municipality. So we have started embarking on civic number communication messaging. Not sure if everyone knows, but it is, I think it's against the law to not have your civic number out there. And also EHS and fire services need a civic number. So we have a push on to get everyone to make sure that your civic number is visible from your driveway. We also are doing communications related to our accessibility advisory committee, public engagement sessions, and we are also going to partner that up with our boundary review sessions that we're going to have, and we're going to have meetings in May and June. They're going to be on Tuesdays and Thursdays, and we're going to be at one spot in each different district related to that. And the schedule will be coming out in the near future related to that. A couple of things in our finance department. We've been conducting interviews last week for a customer service clerk downstairs and for utility and public works positions. And we will be awarding jobs in the near future related to those. Alex has been working with Grant Thornton. They've been doing their walkthroughs on site and our audit is now booked. We are announcing our first budget day. So budget day is going to be May 9th, which is actually council day. We will be having budget sessions from 9 a.m. until 1 p.m. as our first day for that. I can see the excitement in everyone's face related to that. Recreation and active living. So we have signs right now that have come for the community garden, which we are in the process of taking down our community garden beds. If anyone has anything that is in those beds from prior years, technically you shouldn't because they are year over year that they are awarded. But if there's anything up there, please go and get it before they start to be demolished, because once they're gone, they're gone. And then we will be having a policy for for awarding them for the next session of those. So we're going to take them down and then build them back up. We have also received our first trail chair for mobility or for accessibility. We've received our first trail chair and it was delivered to Parks Canada. So that's to go along with our Moby mats and the rest of the things that we've been doing for accessibility. So that's great news. Lydia has also been working on another proposal with Develop Nova Scotia for placemaking project. She's been working hard in Dingwall for our placemaking site up there on getting the picnic space started. And just to let you all know, April is Volunteer Recognition Month, and we haven't seen any names come forward yet. So asking council to think about ways to get volunteers nominated and recognized. In tourism in Dan's department. So what he's hearing from all the operators in the all those in the tourism department, field, that labor and housing continue to be issues, as we all are aware of. He's also been working with the Seawall Trail and having meetings on an integrated approach for awareness for getting the Seawall Trail up and developed. Dan is also going to be he's going to be presenting at the BABTA AGM next week and talking about the new website that they have. He also is working on doing a placemaking beautification program. So putting in an application for beautification for different placemaking sites around the county. In community development, he has been down in Ingonish forming a steering committee for placemaking initiatives and a major project revival for Main Street down in Ingonish. He's been working in Dingwall on the placemaking and looking in Bedeck at a pilot project for a comprehensive community plan. And in trails, our application has gone in for trails improvements. So hopefully looking at hiring a community development assistant for that. In public works, again, heavy garbage is starting May 9th. Our community garden repair is happening starting next week. Down in Councillor Organ's district, the beach down in Neils Harbor, there will be getting new stairs. That will be happening in the near future. We have costs that we've quoted out for the sidewalk repair in Ingonish, and that's a discussion we'll be taking to budget on May 9th. Also, we have quotes for building renovations for our Dingwall and our Bedeck site, and these will be things that will also be coming to budget. We have a side loader tender, which is almost complete and should be going up by the end of the week. Just to let everyone know who is on a water bill or on our water services, our water bills will be going a little later than normal. We have new staff learning the systems and learning all the new civic addresses, so please be patient. They will be coming very shortly, but probably a little bit later than anticipated. This was asked of us last year, I believe, for ways to dispose of household hazardous waste. We are looking at having a household hazardous waste site drop off in both locations, one north and one south. And we're going to be doing it on a weekend in June. One will be a Saturday and one will be a Sunday. It's extremely expensive to get this organization in, So we're going to do it in as concentrated time that we can, but it will be announced, and we'll be collecting household hazardous waste. And our clean leadership intern is starting to work here on May 19th. So there's a few projects that we'll be having that intern working on. In EDO, a few things going on there, economic development. Final stages of completing the retail marketing analysis that we have on the go. She's also been working with several different businesses around the county on succession planning, and the focus is mostly on immigration. She's been having housing meetings and plans, along with several other initiatives, but is looking to sign up for a mountain bike summit in June. I think her and Dan are probably going to be going for that. Related to transit, we've taken that on here. So I've asked for an update from the transit administrator. So our new transit administrator, who was introduced here a couple of weeks ago, Keegan, he was able to get some face-to-face time with Straight Area Transit to get the admin duties down. He seems to be fitting in quite well and getting quite comfortable with it. He signed up for the Rural Transit Authority. He says since the phone number has gone live, he's taken about 25 calls a day. He is seeing them at different times of the day. He's thinking he might want to set out some operational hours for getting those calls. He said of those 25 calls a day, he said there's been 39 unique riders. And some may not have known that the service was available, but thought that the push that we've had on our website and social media has made it more known. He said of those trips that have been taken, there was 13 trips to Sydney, two were to other locations outside of the county. Most of the rides are for medical appointments, some were for shopping, and a few were for tourists without vehicles. A couple of other things that I have, just another reminder, we're doing a regional EMO exercise May 18th. That's mostly just for your information. I had in my report that I was looking to get a hold of Nick Charlton. I was talking to him today. He's going to be sending me some type of draft report in the next couple of days, or so he thinks. One other thing, I was in discussion with DNR today about the White Point site for our potential for the transfer station down there. Couple of other steps that we need to get done before they're willing to make us a proposal on getting that piece of property, but it is moving along a little bit. And one last thing that I didn't have in my report, but I was just thinking of it as I was watching the owl on the camera here. Something we should think about is looking to move council to different districts, since we now have the ability with the with a lot of the sound and with the cameras. So it's something that we should think about. So if it's somewhere that you're interested in having us do that, please send in your thoughts on where we should go, and we can see about having that happen.
Just one question, Ian. The rides for Victoria County Transit, you said there were a certain number to Sydney. He hasn't broken down into how many passengers were taken. Was it one or were they?
I
No,
don't have that right now.
you don't have it, no.
No.
I'm just saying, because we always pointed out that if 2 or 3 or 4 people go, you divide the cost by the number of people, right?
Right. So.
And then we had even, I think, Larry, you had talked about North making appointments at the regional, for example, if they could schedule them so that 2 or 3 or how many people could go at the same time. So.
Yep.
But anyway, that's only a month, so I mean. we gotta-
Right. Yeah. I think he
Progress.
just gave me a little bit of an update. He's just
Yep.
getting his feet wet, and then he'll be bringing reports back to Victoria County Transit when we have meetings.
Thank you.
Councillor McDonald and then Councillor McNeil.
Yes, just in regard to the civic addressing, first and foremost, importantly, through emergency health services and fire departments, what have you. Most people are under the understanding that it's responsibility of the municipality, because in the past, the fire departments used to make out the civic addressing. That's not the case now, so it's the responsibility of the homeowner, is that correct?
It's the responsibility of the homeowner.
And there's no incentive from the municipality for them to get that? Because there are people I know that can't afford to do that. I was
No.
just wondering if there's.
No, there's nothing currently.
Thank you.
Councillor McNeil.
Thank you, Ward. I'm just wondering about the Destination Cape Breton Festival program. Is that just Bedeck and Ingonish that involves? No.
Festivals and events is open
Okay.
from Destination Cape Breton, same as it has been most other years. I think it was on hold the last couple of years.
Yeah.
So if there's an organization that's looking to get some funding from festivals and events, by all means, have them apply.
Yeah, but the festival program launch, 8 weeks of live music in English and Badek, is that just for those two communities?
Currently it is.
Okay.
But if there is something else that you're looking for, I believe that Dan has been talking about your area as well.
Okay.
For something.
Okay.
Yeah.
Thank you.
Councillor Organ.
Leanne, with the hazardous waste, the cost of that, we should really put a push on and really advertise that, because not a lot of people, read it. So word of mouth and everything, where it's so expensive to get those. things
Yeah,
out.
right. So hopefully counselors can spread that out through their networks as well. Because it's extremely costly, but it's something that's been asked for. So yeah, let's make it worth our while.
What date was it? June,
I don't have dates yet. We're trying to, it's an organization that comes in that collects it. So we have to get those dates from them, but then we will be pushing it forward. We'll let you know.
Any other questions or comments before we move on? Okay, thank you very much for your report. CAO's report and new business. We're going to move on to the taxation update. The CAO, I guess, is going to provide that.
Yep, sure. So as of today, we're at 800,000 total outstanding compared to 864,000 last year. So we're 64,000 ahead. Of that 800,000, there is current outstanding of 464,000. So it's a little behind last year's number of 417. And also of that 800,000, arrears of that number is 336,000 compared to 446,000 last year. So what's really important there is that we're $110,000 better in our arrears than we were at this time last year. So that's really impressive where we're moving. And since our last update, since 2 weeks ago, $50,000 has come in towards outstanding taxes. We're still on target for our June 21st tax sale, which is booked for in-person at the Inverary. We've booked it down there. We used to have them in this room. We've booked it down there due to anticipated interest because there was so much interest at our last tax sale. We actually made the news related to it. So all title searches right now have come back. We have 40 properties to move forward with this sale at this point. And so that's good news. So if you're on the list for tax sale and you're not interested in having your property go to tax sale, you should be contacting our tax department to make arrangements or pay off your taxes because we're taking this very serious.
Any questions in regards to taxation report this evening?
I missed that date. Was there a date on that one?
June 21st?
June 21st?
Yes.
At the Inverary Inn?
Yes.
At what time?
Yeah, we'll have to let you know on that.
Okay.
June 21st at the Macaulay Conference Center, time to be determined. Okay. Any other questions or comments in regards to the taxation report? To move on to Department of Work, Public Works issues, we'll start with District Number 1.
Also, spring grading is needed throughout the district, and a thorough grading of all the walls, not just
Yeah, and thorough grading of all the roads needs to be done. Washbook Road from the ferry to McKay's Point, right in Little Nares, in Washbook, needs patching desperately throughout the area. At the meeting with the deputy, I asked for this road to be considered for maintenance paving in the next 2 to 3 years too. The the situation in front of the post office in Iona, asphalt is needed, signs are needed. It's a dangerous area. No matter what side of the road you're on, it seems to take you to the opposite side of the road. So they have to look at that in the near future. There's heavy garbage that from Public Works, old culverts and such, that has to be picked up on the John L. George Road. And also the new ferry in Middle Maris is coming on between May 3rd and May 9th, I was told. Until then, the old ferry will stay in service. After it arrives, transition to the new ferry. There'll be no ferry service for at least 2 years. So the old that. Yeah. Exactly. So it all has to do with the train and the new ferry. And transport, that's to inspect.
Thank you, Counselor. Duly noted. District number 2, Counselor McLeod, anything for Public Works?
Yeah, thank you, Warren. This is for Steve. He knows this. The Red Bridge in Big Bedek is some of the signs are broken, so they need to be fixed and replaced. Westside Big Bedek need repair, gravel road, lots of potholes, no way to avoid them to pass the road. And the road condition in the beginning of the Rocking Horse Ranch is getting less road every time it's raining. So it's just very bad. And that's it. Thanks.
Thank you for those. We've captured them. Counselor Longva, anything from your district?
Yeah, I had the pleasure of driving on Perla's Road there. I went to Inverness, and all I could say is unbelievable. I think they should just turn it to gravel. In my district, I did contact Steve about the condition of the Long Hill Road, and I also included the picture of the Ben Bria Road by the old Redhead School, which was reported over a year ago, and it's still in really bad condition. And also the road in Tarbert where there was a washout is still needs lots of work there. And Steve did get back to me and said, yeah, they have a lot of projects coming up, and there has been, it's just been winter and then wet, and so they are getting on it. And that's it for me.
Thank you, Counselor Longa. Counselor McDonald.
Yes, thank you, Warren. Just to a couple of this evening, all these concerns have been forwarded to Public Works and Steve McDonald. Just Mountain View Road in Dingwall, the intersection just up in front of the post office there. There's a few holes and damaged parts of the shoulder that need to be assessed and looked at. Cars are getting some damage to the size of the potholes there in the location. Second thing is grading of all roads in the area, especially the road to the wharf in Dingwall. Fishermen are getting prepared for lobster season at this time of the year, and the road's pretty bad, as is most every year at this time. A big one is up in Capsic area. There's a sinkhole discovered 3 or 4 days ago that requires immediate attention, and Public Works is aware of that. And I received a reply from Mr. McDonald today that engineers were on site, are in the process of working at that effective today. Fourth is a hill in Cape North by the fire hall. There's pieces of asphalt missing heading up to the hill. On either side, there's no shoulders at present there. There's marked off with cones, but there's traffic is going into the left-hand lane on a blind spot of the hill. And that needs to be addressed sooner than later. And that would be it for TIR for District 8.
Thank you, Counselor. Counselor Oregon, anything for Public Works, please?
Just a few things. I'll be forwarding this to Steve. All gravel roads, like every other district, needs to be graded and filled. I was wondering when the shoulder of the roads will be repaired, especially with the damage from the rainstorm. There's a lot of pavement and shoulders missing. And I also would like him to meet or talk to him about the coastal erosion, especially on Fairview Road in New Haven. I'll be forwarding them to him.
Thank you, Counselor. Duly noted. Deputy Warden Doffney.
Yes, thank you, Warden. Nothing tonight. I'd like to send out some thanks though to Steve McDonald, the area manager who did visit Ingonish last Thursday, and we did a tour of the area. And he also met with some citizens, had some concerns with the highway. So overall went really well, and looking forward to the work being done. And that's it. Thank you.
Thank you, and thank you for your report. Councillor Patterson.
Thank you, Warden. I believe it was the last meeting I mentioned some potholes on the upper section of the Kent Head Road. They were repaired since then. So I wrote Steve and Joey Parker, a pothole repaired is a vehicle spared. So I don't know, but anyway, they did do them. The other question, does the Department of Public Works still have their 5-year lists? They do, Paul? Okay, so you can find it on their website. Yeah, okay. No, I was just wondering. I wasn't quite sure. So, okay, thank you. That's it.
Thank you, Councillor. And I just want to just reference, similar to Councillor Longa, some significant pothole at the intersection of McDonald Street and Hilltop Crescent, first reported August 15th of last year. It's now April 25th. So just like to see that perhaps get addressed. I think I saw the truck around with some hot patch today, so maybe that's been addressed. If not, we'll just make reference to it because unfortunately, we know there's a lot of issues around, but if those potholes don't get fixed, we keep getting the phone calls. So I just want to reference that one in particular. So we're going to, any other, yes, ma'am. Yes, Councillor.
I just neglected to mention the Englishtown Ferry. It's been out for a month and a half, maybe more than that. And I wonder if we could write a letter asking why it's out and when will it be back?
Sure can, if you want to make that in the form of a motion, or do you have information on that?
We're speaking to Keith Bain, MLA Bain, and it's supposed to be back this afternoon. It was supposed to be back last Friday, but they ended up having to replace the cable. Don't know why it wasn't replaced while it was out of service, but that was supposed to be replaced. And apparently there was electrical issues. They were getting shocks and there were surges coming into the cable buildings on the ends, and they couldn't figure out what was going on. So hopefully everything's been corrected, and we'll see if the lights are flashing on the way home.
Okay, disregard my request until next council. We'll see if we have a ferry.
We'll expect an update tonight on the way home, Deputy Warden. Just keep us in the loop. Thank you. All right, those are Public Works concerns. You didn't have anything else or need clarification on any of those issues? Very good. Any motions this evening? Notice of motions. So we're going to move on to district concerns and start with district number 8.
Oh, yes, thank you, Warden. Just a couple this evening. I've had some calls from residents in the Dingwall area in regard to, I guess, off-road highway vehicles, dirt bikes and side-by-sides and what have you. And their main complaint is basically of noise and locations that people choose to drive these vehicles. And I tried to explain that it's more of I think, an issue that should be brought toward the RCMP. And they respond back with that they feel that there's no patrols in the area locally. They don't see the RCMP as often as they would like to see them to maybe address these concerns. So I was wondering maybe if I do plan on, or if we could have RCMP soon come to council just to, because I know there was
We actually have a community consultative group with the RCMP, and we'll be meeting with them soon. We've had 2 meetings so far with them, and that's something that we can bring up for them today.
because there was a piece for off-highway vehicles that allowed them to drive on the shoulder of the road. And so I'd just like to clarify that. So for educational purposes, to understand that, to bring that back to constituents. And secondly, still no real communication from the Postal Service in St. Margaret's Village. I've been emailing different people throughout, and there's no time frame. First, when this all ensued, it was back in, I believe it was February, and now word on the street, if I can use that terminology, is that it's looking towards the fall of the year. So that's 2 months longer than what was anticipated. And do we ever get correspondence back from Canada Post?
Received 2 or 3 letters that say, thanks for your letter. We've passed it on.
Right. And I was in touch with, or actually Sean Tobin had called back with, and said if there would be any update that he would provide it back through council. So, and lastly, just for the minutes to reflect, I'd like to take $500 from my District 8 budget for the Bay St. Lawrence Recreation Society for youth recreation equipment. And that's it.
Um,
Do we have to make?
Not for, unless it's over $1,000.
Right.
Yeah.
I was thinking the latter. It's gonna be a
That's why
problem.
I kind of, yeah.
Thank you.
Right. From your district budget, any expenditure over $1,000 requires a motion, but $500, it's captured in the minutes. So thank you, and thank you for your concerns tonight. District number 7, Councillor Organ.
I had a call from a concerned parent about a school bus issue. I was talking to several people and this problem has been rectified. So I just wanted to let them know that I was speaking to them. And I'd like to make a motion. I, Councillor Oregon, move that I take $1,000 from my district budget for the Ingonish United Church Cemetery Fund.
Seconder for that motion, please. Seconded by the Deputy Warden. All in favor? Contrary minded? Motion is carried. Thank
And
you.
that's it for me this evening.
Thank you, Councillor. Deputy Warden Doffney.
Yes, thank you, Warden. A couple of things this evening. First, I want to make a motion for $1,000 from my district budget to the Cabot Snowmobile Club. We're sponsoring the Skidoo race that did not happen this year, but they bought the hardware that I said I would support. So the trophies have been relabeled to next year, so for 22-23, but I'll make that a motion for $1,000 from my district budget.
We have a second for that motion, please. Second by Councillor McLeod. All in favor?
Aye.
Contrary minded? Motion is carried.
Second, I'd like to make a motion. I guess a couple of months ago, we sent a letter, well, it's been more than a couple of months ago, to the Minister of Environment, federal, in regards to snowmobile access through the national park to the communities outlying the park, and we've had no response. I'm just wondering if we could make a motion to resend that letter and just note on it that it's a second attempt or second send, and I make that a motion.
Can we CC that to Blair Party as well?
Yes.
Yep. So you've heard the motion with the addition of the Mr. Parity being copied on that. Do we have a seconder for that, please? Second by Councillor McNeil. All in favor?
Aye.
Contrary minded? Motion's carried.
And the last one, this one's kind of a larger one. This week I had the opportunity, I was at a meeting with the superintendent or acting superintendent for Parks Canada. And we happened to get onto the subject of septic. And she notified me that they were going ahead in the park with doing some planning for the septic for the compound, Celtic Lodge, and the English Beach Campground. So we're trying to upgrade their services. I had mentioned to her that we were also looking at it. I know before I left Parks Canada, I provided the information to our Director of Public Works, and that information had actually got some of the response back, that how many lift stations they were looking at. I'm just wondering, Leanne, are you aware of anything that's gone past since then, or?
Yeah, I'm having a call with them with Parks Canada on Thursday morning.
Perfect.
And I wanted to talk about future developments and future projects.
Okay,
So-
no, and that's what I'm concerned about. I know with the water system when it went in, Ingonish is probably the only profitable water system that's in the county, and it's because of Parks Canada and the Celtic Lodge, the major users. And the province at that time, they put huge funds into developing that system. So I think we're in the situation again where we have Parks Canada looking. It'd be a great time to piggyback on them and actually put the system in place. So I guess my motion is just that staff be directed to contact Parks Canada, redevelopment of a shared wastewater treatment facility, and also provide council with an update as to where it's going. So, the motion?
It's a motion by the Deputy Warden. Do we have a seconder, please? So, Councillor McDonald, all in favor? Contrary minded? Motion is carried. Thank you. Good report, sir.
And that's it. Thank you very much.
Thank you. Councillor Patterson.
Thank you, Warden. I just had one item, and as the CAO mentioned earlier, there's excitement in the air about Heavy Garbage Day. We may have to make it a national holiday or something. But anyway, I had a number of calls, and I understand our communications officer is working on a flyer to go to the public, so they'll be aware. And it's only 2 weeks from today, actually. So we want to get the word out as soon as possible. So thank you.
Thank you, Councillor. Councillor McNeil.
Thank you, Warden. There's lots of concern about the Nova Scotia property tax. I'm receiving a lot of phone calls lately and emails. There was a request from one non-resident about what information that we could give them about local non-residents that he could form a group. I'm just wondering, Leanne, could you?
Yeah,
Give me some-
we can't give out people's information. They can find, if they have access to property online, they can find out the information themselves, but we will not be giving out personal information.
Okay. No, thank
Sorry.
you. And no, there's lots of concern about this tax in rural areas, like I said before. And we should make some communication to the provincial government about it. Also, for the fire department insurance, I received an email from an individual involved with the Iona Volunteer Fire Department, and also Lyle has been working the past few years on fleet insurance for all of the municipality, and it seems like he was having problems getting information from some of the fire departments. And now basically the insurance company he's dealing with, basically it's dead in the water because of that. So I think we should look at the fire departments supplying information that our director wants them to supply as soon as possible. If not, there should be some kind of a penalty towards it. Because I know it's just looking for like a better rate for all of the county. And it's for all of the counties.
Yeah, so we have hired a fire services coordinator who is to gather information and do things for the benefit of all the municipal fire departments. So I believe that it's up to this group. The only thing we really can do is keep their funding from them until that information is provided. I'm not exactly sure what information it is that the insurance company needs.
Well, basically, my understanding now is he'll have to start from the very beginning again, and he'll be looking for this information from all the fire departments again. So if he's looking for this information in the future, he should get it as soon as possible.
Because that was one area that, one of the things that was really important for this fire services coordinator was to have a concerted effort for insurance, because we thought insurance was one thing that we should be able to get a better rate on. So that's a discussion for you guys. What are you willing to do until, to get Lyle that information?
Yeah. Like maybe we'll come back the next meeting with what we want to look at for all of the fire departments. I just brought this up today, so like in case you guys didn't know about it. So consider that for the next meeting.
Yeah, and if Lyle is needing information to help all the groups,
Yeah.
they all should be providing the information that they
Exactly.
can. And if some can do it, then others should be able
Yeah,
to.
being fair, like I was talking to Lyle prior to the meeting. He said there were, it was hard to get information from all of them, but a few of them didn't give information that he wanted at all. So, okay.
Do we, maybe Lyle can just give you what the fire departments there are, and as a councilors, we can just talk to the fire chiefs. Fire chief? I
Yeah,
don't
we could look
Because
at that.
what we want,
But
what
I
we
thi-
can do, like you say, we can hold the funds, but what is the problem for, what kind of
Yeah.
information she's asking?
Yeah,
Maybe
well, he
some
was looking for
information.
their prior insurance and pictures that the insurance company wanted
Oh,
and things like that. And it shouldn't be hard to get.
no.
And they didn't supply it, so it has to be looked at. And also, I'd like to make a motion to take $1,000 out of my district budget to the Nova Scotia Highland Village in the help with costs associated with the youth choir for Celtic Colors again this year.
It's moved by Councillor McNeil. Do we have a seconder for that, please? Second by the deputy warden. All in favor? Contrary minded? Motion's carried. Money's allocated. So just before we leave that, we kind of left that hanging about the fire.
Oh, sorry.
What, or
Well,
I think that if Lyle is, so usually fire department funding goes out in two different phases. One is they request it and we give half of it. The other one is we are looking for their financial information and their list of members. We can add onto there that we can find out from Lyle if there's information that's needed, especially this or any year in particular, if there's something that's needed. And they shouldn't get their second tranche of funding until that information is
Maybe
prepared.
if we could have Lyle at our next meeting to kind of present what he has done in the past and what possibly they'll be looking for in the future. If
So-
that's possible.
So Lyle has, they do have a fire services committee
Maybe, okay.
that could meet so that Lyle could present to them, to the fire chiefs, what is needed, because all the fire chiefs are supposed to be at that meeting.
Okay.
Because it's probably more important to go to the fire chiefs than it is to go to council here related to it.
And we met with Lyle, Councilor McLeod and I. We are the fire committee of council because we're not affiliated with any fire departments. And we had a discussion with them last month and we're going to meet with them again within the next couple of weeks. So we'll bring the issue forward with them at
Okay,
that
that's
time.
good. Thank you.
Thank you, Councillor. Councillor McLeod, anything this evening?
Yeah, it's just a comment. Yes, Saturday I went to the 4-H public speaking, and we have the provincials in Greenwood Church. Just I want to send a letter to congratulate the 4-H members and leaders for the fantastic job they did in the regionals of public speaking this past weekend, and good luck to the members are going to provincials in May to Truro. So we recognize the importance of the skill of public speaking. So I just want to congratulate them.
Very good. And we'll capture that in the
Yeah,
minutes.
I
and-
sent the motion by email. Councilor McLeod moved that we write a letter for each leaders and members to congratulate them for the fantastic job they did in regionals of public speaking, and good luck in the members going to provincial.
Okay, we have a second for that motion, please. Councillor Longva, all in favor? Contrary minded, motion's carried. Thank you, Councillor.
Yeah, you're welcome.
Councillor Longva, anything this evening?
I was wondering if there was much feedback from the survey that was sent out. Oh, awesome. And I did get, someone contacted me outside of the survey and said they're willing to like house a family. And we talked about not organizing a committee yet until we get more feedback from all the surveys, the one here, and then it was posted also on the Time Bank and on the event sheet in our area. I did have a call about garbage at the look-off between the Bedeck Bay turnoff and the next turnoff. That look-off that's there is, I guess it's in really bad shape with garbage, and I wondered if perhaps when we are doing work with through ACAP with the trash busters, if that could be an area perhaps that could be looked at that time. I've had lots of people talking to me about the non-resident landowner tax, and have we written any letters to the province in regard to that tax? And how much we don't like it?
Yeah, there was a direction from council last meeting to contact the Department of Finance and ask them to send down representatives. So they would give us a clear definition and understanding of how the tax is going to be implemented and potentially what impacts it could have on residents and non-residents. So we haven't heard anything back from that yet. I know all of us have been receiving correspondence, emails, calls about the non-resident tax. And it is a provincial tax. I'm not sure what else we can do other than express that we have heard concerns about that particular tax, particularly from people that obviously it affects. And I'm not sure what direction we want, what else or what other recommendations that might come from council tonight. I was going to leave it as an issue that we'd speak about before we adjourn this afternoon, but since it's been brought up by two counselors already, maybe now is the time to have it, but I don't want to have a long conversation about it. We've been here since 12 o'clock, so I'm just thinking if anybody wants to just enter in on the conversation and has a recommendation or suggestion, now is the time to do it.
Well, can I just make a suggestion that you and I got a couple, I got a couple. What I did was direct mine to MLA Bain, the finance minister, and the premier. And I think if we consistently, and most people realize that it is a provincial tax, the ones I've gotten anyway, but they just kind of want to vent at us, I think, get everything out there. But I think if we're consistent in what we do with them, I did get a reply back from the premier's office. The old story, there's an overwhelming volume of correspondence, so you know what that means. But anyway, at least, it's in his office anyway. He may not read it personally, of course, and then the finance minister and then ML Bain, I think should be would kind of copy to that too, so.
Yeah, I hear the same thing you're hearing, but it's not our legislation to fix. It's
No,
it's a
but
difficult-
I think, need to lobby it because in my own area, like there's so many non-resident landowners
Mhm.
and that includes like children of people who live here. They're like family and they're gonna have to sell their places because they can't afford it. Not only that, like they go eat at the Clucking Hen, they eat at the Dancing Moose, they buy at all the shops. It's like gonna hurt the economy very badly. And
Yeah.
it's gonna hurt friendships because they've been coming here for so many years that, I don't know, I think we just as a council need to stand up for those people and say like, we don't agree.
So, yeah, go ahead,
No,
Councilor McNeil.
I agree with Councilor Longo. If we could write a letter to the minister, I don't know, or the treasury board, I don't know.
Minister of Finance.
Minister of
Yeah.
Finance, and stating that especially for rural municipalities, the tax kind of oversees the amount that it should be, I guess. I don't know how to put it yet. I'll make it that a motion, and when I think of the motion, I think.
Yeah, and I think just we don't, if that's the direction we're going. I just want to make sure anybody else that wants to comment on it before we make the motion, anybody else, Councilor McDonald?
I was just wondering, you said we never received any correspondence? I guess my question, what's the justification for this tax? Like, we have residents that are asking.
Okay, so my take on this is that all the province is looking for affordable housing, for some way to get affordable housing. I believe the province has taken a stand on this. This is an initiative that you've all said that housing is a priority to you. Those people who are non-residents possibly have land. They're coming here. It could be Airbnbs. It could be these properties. This could free up properties. I'm not saying that is I'm not saying it is correct. I'm saying it is something that the province has chosen to do. It is their first fix at what the solution could be. I don't 100% agree with what they have done. I think it needs to be tweaked. I don't think it's completely wrong, but I also don't think that it is completely right. I know that Councillor Patterson, we've had conversations in the past where you talked about taxing foreign property owners. So this is not something new, but now that it's happening, you're hearing from those who are non-residents who have to pay this. I don't know if we've heard many who are on the other side who are looking for housing. I don't know if the housing that these people have or that all of them have, I don't think it's all the same. I think there's some who are really large, expensive homes that is not affordable housing. But then there's others who probably have lots that could be affordable housing for locals. So I don't know. I don't think it's the completely right answer, but it's their first take at something here. So I think we need to be very careful on what we're trying to say here. If we are in support of it, if we aren't in support of it, because the whole point behind it is for housing. Although then when you look at that, the money's not being put into affordable housing. So I think that, I think you got to be careful in the stance that you're taking on this.
Yeah, and
Sorry.
sorry, but
Just two things to follow up, and I agree with pretty well all you said. First of all, the money's going into general revenue.
Yes. Right.
They're not putting 1 cent into housing. That's the first mistake they made.
Correct.
The second mistake is doing it to everybody. And we know there's places that are $1 million, summer places, we all have them in our community, that's never going to be opened up to the market in Cape Breton because you have to, you just can't afford it. They should have been more strategic by picking places or land, as you say, that's probably the most important thing, that would be available for local people to purchase or build on. But I think what we have to do, what people are, since I get from people, is it's just what I've said. It's not fair. A lot of them too, in my district, are old family homes.
Yeah.
This is where these people grew up. They couldn't get employment here, so they moved to the New England states and lived their life there. Now they're going to come back to their old family home that's been in the family for generations and be taxed an enormous amount of money. You know, like Councilor McNeil says, $2, that's more than we charge, you know, $2 per 100. So I think we can write the letter pointing out that we are getting concerns expressed to us as councilors from, I think everybody's got some, and maybe make a couple of suggestions of how this could be improved or whatever. One more piece of information. In the year 2000, the John Hamm government tried the same thing. Actually, they didn't try the same thing. They were going to give municipalities the power to tax more for non-residents. It went through 3 readings, it got royal assent, and then it disappeared. You know, because it is not fair to the people who have been brought up here and lived here their generations back and their families. So that's my biggest point of it anyway. Thank you.
Yeah, and we had the conversation here last council meeting that there was no consultation or communication prior to having the bill put through. So, and now we're talking about it after the fact, right? So I'm not sure, and I agree with everybody that spoke to the issue. Like there's lots of people that are affected directly or indirectly, whether it's a family member that wanted to come back or a family member that already owns or somebody that is a short-term rental person. There's all kinds of issues around this and it's complicated. And it's ending back at our email boxes and our phone calls. So I'm just not sure. I think we write to them and then we ask would the representative come down here. And I think we give people that have concerns the opportunity to talk to the people that enacted this bill. It's not our legislation, it's their legislation. And I keep going back to as soon as people see property tax, they think municipality and it's a tax grab for municipalities. And we know it's not, and they've said it has, and it's not. But at the end of the day, it's become a very expensive place to live if you don't live in the province of Nova Scotia. So, yeah, I agree with Leanne. It has not solved the issue that we have here with affordable and available housing. It doesn't do it. But so where do we want to go with this one right quick? We want to send the letter or go ahead?
I think you're right in the first part is it's not our responsibility, but I think what I've been doing is forwarding the letters on to our MLA and into the Premier's office and stuff like that. And talk to a number of people in the government. I am hearing, and if it's going to happen or not, that there probably will be amendments to this because they are listening to what's going on. So I don't think we have all the questions answered exactly how it's being rolled out. And I think what we already did by going to the Minister of Finance and asking someone to come down and explain it to us. It'd be nice to actually have someone from the government sit down and explain exactly what it is. Is there going to be amendments, or do they feel, do they know at this time? But I think we really got to tell everyone that's replying to us is that they got to forward this on to the proper authorities, being the MLA and the Premier and the Minister of
Well,
Finance.
also, we talked about this at the last council session. So there is a website that's available for it on the Financial Measures Act.
Yeah.
And if anyone has any concerns, they forward it on to nspropertytax@novascotia.ca or nsdeedtransfertax@novascotia.ca. There's 2 email addresses that are available for anyone who has concerns with this.
Councillor Daphne just brought up a good point. I had thought of before. Can they appeal this? I mean, you can appeal your property assessment, but, you know, so.
I don't know. It's not, we're
Well,
not
that's another
administering
question,
it. So that's a
Because, I mean,
question. That's a
They should
question.
have the right to appeal if they don't agree with the assessment.
Yeah, well, you would appeal your assessment. And then that would be it.
Yeah.
It just, and I know Councillor Organ has a question or a comment.
Leanne, can you put that on our website, those addresses? It
Yeah.
is? Yeah, so we can just say to people that we get letters from, you know, on our website. Forward
Yep. And
your
it's
concerns.
in the minutes. So we had correspondence, yes, and we have shared that. Yep. Right.
Here,
But yes.
and
But still, I think, like Councillor Longba said, I think residents are looking to see what council thinks about the situation. And I still think that the $2 per 100 is an absorbent amount of money to pay for anybody. And I think council should send that in a letter to whoever stating that. Like, I know it might not.
So exactly what motion you want?
Again, I'll have to think about the motion. And
Yeah, because I can vote it.
Yeah.
I don't know the motion.
So that's probably a notice of motion for
yeah,
the
a
next
notice of
council
motion
session.
for the next council.
let's put it there. I don't think
Yeah.
we're going to solve this one tonight. I think it's important that we capture the conversation in the minutes of council so that the residents know we are
Yeah.
struggling with it. And whether it's a financial amount or a philosophical issue as far as the land ownership, but and when we agree with the intent was to free out, you know, we agree with that the intent was to make more properties available and affordable to local residents.
And will the funding go to different municipalities, or will it all go to one municipality if you know what I mean?
Exactly.
Right. I think what we've been talking about since this news came out a couple of weeks ago was, I think we agree with the intent,
The intent.
but it needs to be tweaked somehow.
delivery.
So, but that may not be how council feels, and I don't know if council, so, you know, that's my take on it. I'm not for it. I'm not against it. I really don't know.
And I do like the idea of getting a representative down here to, you know, because for us to get the information, we didn't start it. We're not responsible for it. Let the people that are answer for it. So we'll follow up with the request again. Hopefully when, if we have a representative come down, people can join us virtually or in person and bring their questions directly to the representatives that are responsible for it. So, and we've also passed along our comments through the Deputy Minister of Municipal Affairs as well, and Housing, and he knows, and I'm sure we're not the only municipality. We know you open up the paper, the Chronicle Herald, there's letters upon letters in regards to this. So we're amongst many. And I don't know, just to take it one step further, I don't know, if I'm a resident of Bedeque, I pay county taxes, I pay village taxes. Does that mean that I'm going to be paying, or if you're from an outside resident, are you going to be paying more on both? I don't know. So there's lots of questions around it. So, all right. So can we leave that conversation there? Thank you. And we'll contact, did somebody make a motion to contact? We already have that in the minutes about contacting a representative.
I don't think we do.
Well, can we have a,
I don't have that. I don't have it noted.
so it's just to formalize it, I think that was their understanding that we were going to contact somebody. So did you want to make that a motion? So do you have a seconder for that? Second by the deputy warden, all in favor? Contrary minded, motion's carried. So were there any more?
Oh,
district
yes, of
concerns?
course.
Sorry.
Yeah, well, one thing didn't really understand, like, I went away on my vacation to see my daughter, and because it keeps coming up, we discussed this at the last meeting, which I wasn't, I couldn't join.
Yep.
And I still don't understand really why I couldn't join. Because we've had people from Toronto here talking about housing on Zoom. We've all been in the chamber. We've had, I think the first council meeting I ever came before I was councillor, Paul was on Zoom because I think he wasn't feeling well or something. Then we had Jackie and Norm another time on Zoom, and I wondered, and I guess I didn't really understand what was explained, why, like, if someone's away visiting their family or for some other reason, why they can't, if they want to. I mean, if you're on vacation, yes, of course, some people might not want to, but I had the time and I did watch it on Facebook, but I don't understand why. Did you say something that there was no mandate for that, or, and if it's a mandate,
Yep.
is it something that could be changed in the future?
We don't have a policy for it, so that's something we'll look at. And
So currently, we're trying our best to do a good presentation with the people who are watching, live streaming, and who are in the room. What we have found when Paul was online, that was a year ago, before we had this camera, and when Norm called in for transit, and when Jackie and you called in for some other presentation, you can't hear. We had to call you on the phone. The sound doesn't work. You're muted. It's not a good presentation. So we are choosing right now for our presentation purposes, and we're going to come up with a policy. It's either all virtual or all in person. If there's one person presenting online, then, which sometimes we have a person presenting online, they might be able to do it that way. But if it's them plus somebody else who is counsel, who's supposed to be part of the group, it's not the best virtual experience. So that's why we've chosen. It had nothing to do with you. It's just.
I didn't take it personally, but I just wondered why, like,
It's
what the
just- it's not a
reasoning.
good- You can't hear, you can't participate. It's just not a good, we're choosing not to do that for the program that we're trying to present. Especially like now, if we're telling you, turn your mic on, it's because somebody's watching in the background and trying to make this so people can hear it. So you're part of the experience.
A lot of it too was we did this during COVID.
Okay,
Okay,
so, and
we're
I
good.
still have some more. I'm wondering, because we're getting really close to that first budget meeting, I'm wondering if there is going to be a public meeting in regard to the new facility, and because there is a big ask there, and I would like to know the feeling of the communities before we have to make that decision. Like, it's a big decision to make. So I wondered if there was going to be some kind of a public meeting where people could say how they felt about what the steering committees come up with.
yeah, I guess my answer to that, Barbara, it's a good question, is that maybe CAO will get in touch with John Trickett and find out if they're going back to the community with their findings. It's not a municipal initiative, so it's up to them to. So we'll just ask Leanne to contact John and see what their plans are.
Okay, thanks. So I brought this up before about the trailers in River Bennett. I've had more complaints about them. I mean, they're basically going to float away someday which is not good, because they're going to be out in the ocean with all the flooding and what's happening. But I would be, and also there's a building right across the road from those trailers, right at the road to the Pine Hill Cemetery, a cabin that's falling apart. I would be happy to contact the people that own the places and ask them if they could do something about it, if that's what should be done. I don't know who owns them myself, but I could contact them and ask them, but otherwise, like the people in the community that live by there and drive by there would like to see them gone or something done with it.
I think maybe we can refer that to Eastern District Planning and determine whether or not they are
They'll be
on-
looking for a form completed.
yeah, you just, somebody will have to fill and sign the.
I mean,
form.
I'd prefer to let the landowner know prior to reporting them to be torn down or what's like, just so they have
Yeah,
a chance.
I would say if you want to contact them, that's, you're well
Is
within
that
your,
some information I can get
Yeah.
from
no, yeah, you can,
here?
I think we can find out from properties online who owns them. And yep,
Okay, and I would approach them first, and then if they
Yep.
aren't in agreement, I guess I could
we'll leave it with
get
you. and-
someone to
Yep.
fill a form.
Sure.
And one last but not least, I'd like to give $500 from my district budget to the South Haven Community Hall,
Thank you.
and that's it.
Thank you. The last thing that I had just for my district budget, no motions, but just BABTA and some town residents. We did a cleanup of the village on Saturday morning, so just want to recognize that BABTA undertook that with Don McKinnon, and we picked up a lot of garbage, and I think the community looks better as a result. Not that there was a lot of garbage in around town, but out around the overpass is unbelievable.
Right, that's a good reminder. So just to let all counselors know that there are bags and gloves here for you for taking to your districts for cleanup.
So thank you for that. We, the last item on the agenda tonight is correspondence. We have a note here from Operation Smile, and they would asking us to proclaim June 19th as the longest day of smiles in Victoria County and challenging other mayors and wards to do the same. So can we have a motion to proclaim June 19th as the longest day of smiles in Victoria County?
I make that motion that we proclaim June 9th as the longest day of smiles.
Okay, we have a seconder.
Second.
Councilor McLeod, all in favor? Sorry? It's, you're not familiar with most of you familiar with Operation Smiles? Operation Smiles Canada is a volunteer delivered global medical charity that exists to ensure that everyone has access to safe, effective surgery they need whenever they live in the world. Surgery that will change a child's life forever, especially for facial surgery and for cleft palate. So, and you'll see it, but that's what that's for. And they're asking if we want to make a donation. I'm not sure if we want to make a donation, but we'll claim the day and we'll leave it up to CAO whether or not it's a donation. We wish to make a donation. We had our in-camera session prior to council. So is there anything to come to council tonight?
Yeah,
Prior to-
committee reports.
Oh, I'm sorry. It's been a long day. Committee reports. So you
I have
have one?
As you see the report from BCIT, he's asking about the time for the sketch for him to work for the bookings. So we say the time will be 8:30 to 4:30 for phone calls for booking. But not instead, the weekend will be right available. The people don't know about that. So we have, I wonder if Ursula can make a post about that. You can write all the week, the Monday to Sunday, but the bookings will be only Monday to Friday for 8:30 to 4:30. They can use the website, yeah. But everything have to be 24 hours, so they have to book by Friday, to get that. Hmm? Oh. I will give you in a second. I will give it to you. Yeah.
Okay, thank you. Anything else? We are going to go back in camera. We didn't finish in camera before council, so we take 10 minutes after council to go in camera. Is there anything else to come to council this evening? We have a motion to go in camera, please, for 10 minutes.
So moved.
Moved by Councilor McNeil, seconded by
Second.
Councilor McLeod, all in favor?